Remember Bill Clinton when he said that he didn't inhale even though he'd tried marijuana? Well, a lot of Australians go one better than that. They do admit that they have used it, about 1 in 3 adults. But we're not here to talk about recreational cannabis. We're here to talk about medicinal cannabis. It has been legal for a couple of years, but just how difficult is it to be prescribed and what is it used for? Brad McKay is here for our regular health chat. So let's talk about the difference between what we commonly know as marijuana, recreational, and this medicinal cannabis.
Yeah, so all of us sort of have heard of recreational cannabis. We've got about
1 in 3 have tried it, apparently.
1 in 3 have tried it. We've got about 1 million people, 1 million Australians who are using it on a weekly basis. These are rough estimates, of course. But yeah, it's sort of known to cause a high or a euphoric effect.
So what's the difference if we're talking about medicinal that doesn't have the same qualities?
Yeah, so a lot of people who are wanting medicinal cannabis, they're not wanting that high effect. They're wanting it for other health benefits. So we typically use it for a whole range of different conditions.
So you won't get a high. Has something been, it's been modified, has it?
Well, the whole thing about medicinal cannabis is rather than getting a leaf and drying it and then smoking it, you don't really know what dose you're going to get. So if you've got medicinal cannabis and you've got two main chemicals, CBD and THC, these are chemicals that are purified, they're extracted, and then we know what dose you're going to get with every drop that you're taking. So it's a lot more dignified, a lot more refined. You're not smoking it, and it's usually had as oil drops that you put under your tongue. So,
and what's it used for? What sort of illnesses would be best suited to this?
Yeah, so there's a wide range of uses for it. So CBD or cannabidiol, if we're just using it 100% CBD, we'll often use that for kids. So there's no addictive potential for it. There's no psychoactivity for it. It's not going to make the kids high. And it's very good at decreasing down seizures, particularly for kids that have intractable epilepsy. We've tried every other treatment under the sun and nothing's left. This is another option that a lot of parents are turning to. So other things we use it for are for cancer patients, particularly cancer pain. Also if people are throwing up their guts from chemotherapy, it's fantastic for chemotherapy-induced nausea, but even for multiple sclerosis patients as well, for pain and spasticity.
So is that what it is about? Is about regulating pain? Basically, is that the main effect?
Yeah, so if we're using a combination of THC, the tetrahydrocannabinol, and CBD as well, that can be quite beneficial for chronic pain, particularly neuralgic pain.
Does it work? Is the jury still out on the effectiveness?
Yeah, if you've got about 5 doctors in a room, you'll get 10 opinions. So this is what we're debating at the moment. Certainly, there's a number of clear evidence that it works for a number of different conditions, and now we're sort of like fighting over some of the finer points. There are some specialists and GPs and doctors who are saying that it doesn't do anything. We shouldn't have it at all. You've got other people on the other extreme. So we've got hippies that are on the Central Coast that are saying that it cures everything, including cancer. So science is really finding that it's in the middle. So we don't say that it's really curing anything, but it can make life a lot easier for a lot of people who are sick.
Is there a concern about side effects? I think I was reading somewhere where there may be some concern about impact on the liver and potentially mental illness as well?
Yeah, so for some of the kids that have been in trials in Australia using just CBD, we're finding that some of the children have abnormal liver function tests, and sometimes we do need to stop the medication. So we're needing to sort of monitor that over time. But it can also interact with other medications, and if your child's on other anti-epileptic medication, those can cause liver function problems as well. And so it's a bit of a fine tune of trying to make all the medication work together.
What about schizophrenia? I had heard, talk about that in the past. Has that link been proven?
Yeah, so it can certainly cause hallucinations as a temporary measure. A lot of people have blamed psychosis or schizophrenia on marijuana use or cannabis use. What we sort of understand at the moment is that it may be that people actually have a genetic predisposition for developing schizophrenia, but it can be the THC component that's bringing it out a little bit earlier than what it otherwise would have happened. So it's not 100% safe. The estimates are that you'd need about 2,000 people to use cannabis for one person to develop schizophrenia or psychosis.
And take us through the legalities of this now. So it has been, legal for the past couple of years, but that doesn't necessarily mean easy to get.
Yeah, you can't quite walk into your general practitioner and ask for a prescription for it. I can't dish it out straight away. As a GP, I need to have a specialist opinion to say that it's safe to use in this patient. You've got to apply to a federal level with the TGA. You've also got to apply to your local state as well. There are forms to fill out. They send it back. There's lots of questions. The paperwork is quite a lot. You've got multiple doctors that you need to see to have it finally approved. And I've had some patients who might say, look, that's just too complicated.
So what are they going to the street corner, if you like, the black market to buy it?
Yeah, well, this is my concern.
And then that's not treated in the same way. It's not, it's not used in the same way. The safeguards necessarily aren't there.
Yeah, totally. So if we're putting all of these barriers up, and Australia has some of the most convoluted, high hurdles to actually battle through to get access to medicinal cannabis. And what it is it's creating all of these high hurdles. We're trying to be restrictive with it, but in my opinion, I think that we're being too restrictive with it. So it is driving people to go to the black market. They're finding that it's much easier to walk down to the train station. Granny can find somebody who's wearing a leather jacket and then ask them about cannabis. They're buying it from the street corner. And they often won't even tell their doctors as well.
Safety concerns and
we don't know what they're getting. Yeah. They're more likely to get a high THC dose, so they're more likely to get stoned from using that as well compared to lower doses that we use in medicinal cannabis. And often people won't tell their doctors as well. So we've got no idea what people are having. We can't monitor what they're using.
So you would like to be in a position where you can prescribe that much more easily?
Yeah, I think if people are finding that it's too hard, there's too much paperwork, the hurdles are too high, and they're missing out on a medication that could be beneficial for them, I think that's a tragedy. And I think that we should be allowing patients to have more of a choice. We need cheaper availability, less red tape, and not picking on sick people that are trying to get some help genuinely.
Yeah, good to talk to you, Brad. Thank you for that.
Same here.